Doctor, thanks. That is a grim warning that your state's healthcare system could fail in a matter of days. What are you seeing in your hospital? What are you hearing from doctors and nurses in your neighborhood, your area, your state? How bad is it?
It's pretty bad, Tyler. We're stretched to capacity right now. Our ICU beds are full. We're having to board a significant number of patients in the ER. Our morale is flagging, especially the nurses who are at the bedside all the time and the respiratory therapists. So it's a worse situation than it was last year.
Are the patients sicker with this new virus than with the earlier strains of COVID?
So one difference, of course, is that these are younger patients.
Mm-hmm.
The average age is below 50. Their lungs are as sick or sicker than they were in the previous surges. But what we're not seeing as much of is multi-organ failure. So last year we were seeing people's kidneys and livers collapsing, and we're not seeing that this time. So the lungs are terrible.
Very interesting. You said that you're seeing younger patients in general. What about children? We're hearing that children are coming down with this disease in greater numbers. Have you seen that? So
we don't directly take care of children, but there are a significant number of children at UMC who are on the ventilators. We don't have that facility in this hospital, so I can't give you our own data.
Data shows that the majority of patients coming into the hospitals are unvaccinated. What kinds of conversations do you have with them?
So when these people are in the ICU, that is not the time we can have this conversation. Mm-hmm. The time we have this conversation, I personally have this conversation, is when I see them in the clinic, in the setting where I can influence them. And there are times where I hit complete roadblocks. I've been told by one very young patient, that she would rather die than get the vaccine. So that's what we see.
Are you seeing vaccinated patients in the hospital?
Very few. If we do see them, they are either going to be there for a different reason, that they might have mild COVID but are in the ICU for a different problem, or else if they do end up in the ICU, they do fine. No one has needed to be on a ventilator, and almost everybody gets discharged.
Quickly, what do you want the country to know right now, tonight?
I think what I'd like the country to know is that we're stretched to breaking point, that we need help, and we need help more than anything else with retaining nursing staff. There's a national nursing shortage, but it is especially a problem down here.
Dr. Babra, thank you very much for your insights tonight. We appreciate it.